I'm Dr. Mike DiTolla, and I'd like to welcome you to this episode of Inside Dentistry's Product Talk. We are on location in Mount Pleasant, South Carolina, in the office of Dr. Amanda Seay. Amanda is an accredited member of the AACD. She is one of the clinical faculty members at the Coy Center, and she's also got a great Instagram account because of all the cool clinical cases that she shares. And we're here today to talk about GC's G-ænial universal injectable composite. Amanda, thank you so much for having us into your office today.
Thank you for coming. I'm glad you're here.
Well, it's very nice to be here, and I'm glad we're going to get a chance to talk about this product. You know, you and I came up in dentistry when flowable composites were just becoming a thing. And so it was cool to have a syringe to use, but they weren't very strong. You couldn't do the whole restoration out of it. There'd be a snap, crackle, and pop as the bubbles came out of the end of it. And it's interesting to see what GC has done with this material using this full coating silane technology, where they actually have made a composite that comes out of a syringe that's stronger than most paste composites. And this is actually the strongest direct restorative material GC has ever made. Did it take you a little bit of time to get used to the fact that such a strong composite could come out of what's essentially a flowable syringe?
Yeah, absolutely. I mean, I think like you were saying, when we were using flowable composites, I was trying to use as little flowable composite as possible in my restoration. So to switch over to using it as the primary part of my restoration took some modification of my technique. I was used to handling a very sculptable composite with an instrument that I can pack.
Right.
So it is different, but it's amazing how aesthetic and beautiful it is. You know, to have it as a finished product is something very different that we didn't have when I first started dentistry.
And you mentioned sculptability, and one of the nice things about this material is that as you're placing it, because it doesn't slump or doesn't string, you can kind of sculpt it using the tip as you place it. And one of the best tests to see if a material or slump or not was to use it for a buildup material or possibly even a core buildup, because it'll hold its shape. And if you can freehand that without using a form, that kind of proves that it doesn't slump. Is this the type of material you use for buildups and things like that?
Yeah, I use different materials, but what I really like this product for buildups is, say you have a root canal tooth and you have to build that up. It's usually so deep and the canals are fine, and trying to pack the hybrid material into these little nooks and crannies is really difficult. So this product just really fills it up really nicely and stacks it, and I can kind of push it into where I need it to be. So it's made that process a lot simpler. So
that's great. Well, I know that the material has to be aesthetic, because I know that you're also using it in an injection molding technique when you're doing like a smile enhancement technique. Can you tell me a little bit about that? I know we have a model here where you can kind of walk me through these steps.
Yeah, you know, I teach a lot of composite hands-on courses, and I find that, you know, when people learn how to do one tooth, the next thing they ask is, what if I want to do a smile design?
Right.
And the biggest challenge with these smile design cases is that it's time consuming. It takes a lot of technique and hand skills and patient chair time as well, and cost.
Right.
You know, like, what do you charge a patient if you're going to do a full smile design and composite? So what's nice is you can get a traditional wax up from your lab, you can get a digital smile design, whatever it may be, and you can get that printed or made, and you can just take a simple template. I like to use their clear.
That's the Exiclear from GC?
Exiclear from GC, and just take a tray without holes, take a quick impression of your mock-up or your smile design, whatever it may be.
Or maybe it's just, maybe the contours are fine, but it's an endodontically treated tooth or something like that. So just get the tooth to where the contours are what you want it to be. It could maybe even be a wax up that your lab did for you, right? Okay.
Yes. So as soon as you're done, it peels off pretty easily.
Okay.
And so now you've got this, and then you can prepare your tooth. If you need to do any modifications, do your bevels like you would traditionally do for like a composite.
So is that a pretty typical preparation for you for a veneer
Yeah,
like this?
for like a class 4, I'll do my deep bevel, my shallow bevel. And then you just simply seat it right over, and it's nice because you can see the contours of everything there.
Yes, you can see through. You can see how much reduction you've done as well.
Yeah.
So, okay.
Yeah, so what I would do in the patient is I would isolate the adjacent teeth with some Teflon tape.
Okay.
Do my etch and bonding protocol.
Okay.
And then I would take the syringe right here, and you would just insert through the hole, just poke a hole.
So that's like right through the middle of the
right
incisal edge?
Through the middle, yeah, and poke from the inside out. That way you don't have any flash.
Or if you do, it's on the outside of
On
the
the
matrix, not
outside.
on the inside where it's going to lead to an incised ledge that isn't very smooth.
Correct.
Okay.
So I would keep my Teflon on both the adjacent teeth, and I would just seat it like this.
Okay. And obviously it's got a positive stop on the incised ledges of all the unprepped teeth, so you
That's
don't have to
right.
worry about pushing it down or compressing it facially.
Yeah, and
Okay.
even with a full smile design, your lab can do one with the palatal rest, so it seats and stops on
Okay.
the palate as well. So then you find your hole, and you can always make it larger if you want. But what I do is I like to make my tip and make sure you push it all the way to the cervical of the tooth.
Okay.
Just so that way there's no bubbles, and then you can just slowly inject, and you can slowly move the syringe up as it starts to fill. But the trick is to keep the tip of the syringe in the composite the whole time.
Got it.
Yeah, and then it's almost full. You can see, and you're going to have a little drag out just like that.
Mm-hmm.
And then you can just cure it with the light. And it's really nice, you can see, to get the form and everything else. And if you've isolated your adjacent teeth with a Teflon, then
Right.
the flash just flicks right off.
Right.
Yeah.
Well, that's pretty quick to do the entire facial surface.
One tooth.
Compared to how we used
Yeah.
to, do it, building up and sculpting it and looking
Yeah.
at contour. So it takes some planning ahead of time, and you obviously have to make the clear matrix and things like that.
Right.
But those are all easy steps compared to actually building and shaping it. And so it'd be nice to. It almost feels like cheating to an AACD accredited fellow.
I know, but I'll tell you, contour is king.
Right.
So no matter how well you get shade and layering and all those things right, if you don't get the shape right, it doesn't look like a tooth.
Right.
It's not going to look right.
And you know what? I bet
So-
if you get the contours and the shape and everything right, like you said,
Yeah.
you could use 2 or 3 different shades of the G-ænial universal injectable and still have it be acceptable because you got
Absolutely.
all the rest of that right.
Yeah, and you can offer a great service for the patients and say, do it in a single shade, charge them, a minimal fee, and say, if you want to upgrade it to a different level aesthetics, you can always cut back the window and layer in a little more if
Right.
you wanted.
Put some more, whatever, a more a translucent incisal ledge or something
Yes.
like that. And it's done in essentially one appointment for the patient. There's not a question of temporization like there would be with an indirect veneer. And
Yeah.
it's funny, when you and I started practicing and all of a sudden we had lucite reinforced ceramics, we were so excited to start doing veneers
Yes.
out of those materials
Yes.
instead of full crowns
Yeah.
on anterior teeth. And it was a step forward in terms of aesthetics, and we kind of thought it would never go away. But now today, if you have a single unit like that, it's got to be pretty tempting for you to go the composite route and not necessarily the indirect restorative route.
You're right on. I mean, I really prefer if finances are ever an issue for patients and they ask if there's other options, and I'll tell them, there might be some more maintenance after a couple years, but it's cost effective, it's simple. There's usually no tooth reduction in
Right.
these cases, which is really nice.
That is really nice.
So because you can get it as thin as you want, and don't worry about path of draw or any of those things. So I'm doing these more and more, and the chair time is really minimal for
Well,
it.
excellent. Sounds like a great service for you and a great service for the patient as
Yeah,
well.
thank you.
Perfect. Well, that'll about wrap it up for this edition of Inside Dentistry's Product Talk. On behalf of Dr. Seay, myself, and all of us here at Inside Dentistry, I want to thank you for your time and your continued commitment to quality dentistry.